Hello, ladies and gentlemen. Welcome to ITV. My name is Yara Jack, and on today's interview, we're going to have the Honorable Minister of Health, Yolanda Awelding, and we're going to be talking about substance abuse in South Sudan, and especially among the young people and elderly people. Over time, we've seen people, young people, and also elderly using drugs in the country. And so we want to get from the ministry's perspective if there is a body that regulates the use of drugs in the country, and also the certain drugs, if they are legal or illegal in South Sudan, and how the country and the people of this country should be able to use them. So, Honorable Minister, welcome.
Thank you, Yar.
How are you doing this morning?
I'm doing good. I'm enjoying the weather.
It's such a good weather. And how is it so far with the ministry? You just came in and everything. How is it picking up?
It's good.
Okay.
It's good. I can't complain.
All right.
Yeah.
All right. Thank you for giving us the opportunity to do this interview today. And my focus, I just want to focus basically on substance abuse in the country. And over time, we've seen there's research that have been done that young people and elderly people in the country are abusing drugs. And so, as the Minister of Health, what is your take on that?
Thank you so much, Yar, for bringing up this topic. This topic is actually very important for the growth and the health of this country. First of all, we should ask ourselves, what is the root cause of people abusing drugs?
Okay.
What is pushing them to actually like self-medicate? You know, like what is making them go down that path to make them feel better for the day or two or so. So to me, it goes back to our long history of civil wars, our long history of chaos. It goes back down to trauma. It goes back down to intergenerational trauma that has been inherited. You know, like you and I have got some genes, you know, that is decoded from the war that like we had in the country. So when children are born, they are born predisposed, you know, to stress, predisposed to depression, predisposed to actually psychological chaos. So, and then coupled with the ongoing conflict, you know, and the conflict, like it does not have to be shooting. It does not have to be a political one. We have got issues with economy. We have got issues with climate change. We have got issues with families trying to make ends meet. So when all these things do not add up, people are pushed to frustration. And when they're frustrated, you know, like they will look for some ways to ease themselves. What are the ways to ease themselves? Substance. For example, shisha.
Yeah.
You know, like young female, like more of my age and you yourself, and now you find them in the evening. You know, they tie their children on the back, or they're pregnant or breastfeeding, and they're like, you know, relaxing and taking shisha. It is because one or two things are not actually clicking. But the main thing is this: that shisha that they're taking, it smells sweet. It has got the aroma of fruit. It has got like the sweetness in the mouth, you know, when they're testing it. But the chemical reaction in the brain with the neurotransmitters, like, you know, your brain is actually like alter your body. If you are breastfeeding, you pass it on to your child. If you are pregnant, you pass it on to your child. When that child is born already predisposed, you know, to substance abuse. So like the cycle continue, you know. So like that is like with the section of now, let's say the female, and also like the same thing with male, because like, you know, the male of childbearing age, they also pass it on to their offspring through their genes is genetically decoded. Yeah. So the substance abuse has got so many factors underneath it, and all this thing goes back to mental health, you know, wellness, because as maybe you know or you don't know, it is my area. You know, like I'm a psychologist. I did several, you know, specialization and training in it. You know, and when I see my patients or when I see my clients, it is mainly on the surface we are seeing substance abuse, but underneath it there are so many layers. Okay. You know, like the layers to do with trauma, the layers to do with trying to make ends meet. You know, like the layers to do with struggling in the homes. For example, let's say a father who has not been paid, and we know like the way our country is going, whereby, let's take for example like our organized forces. They go for months without being paid, and that the people protecting us in the country, our civil servants, they go for months without being paid, but they have their families to feed. You know, when you go home and you have got nothing in your hand, and you see like the struggling, and the suffering, like, in your spouse's face, it pushes you to be violent.
Exactly.
And when it kind of pushes you to be violent, let's say like now we have got rampage domestic violence, like in our communities, it all goes back to that. It all goes back to all these factors that I'm talking about. So, and in a nutshell, it's actually centered like in the psychological well-being of the country. We are not a psychological, upright nation, because we have got so much trauma that is going on. We have got so many developmental issues that are not ticking the boxes, that is pushing the population, our citizens, toward like the brink of frustration. And then that's why a lot of people are self-medicating themselves, like with the shisha, as I mentioned, with some illegal drugs. Like in this country, taking weed, it is not legal. It's not a legal drug. It is illegal drug. We have got so many like illegal drugs that find their ways, into the country.
Yeah.
And it is because we have got so many borders. And most of these borders are like either they are controlled or they are not controlled. But some people smuggle them in, because like let's say if something's coming through normally, of course government is not going to allow it. But we have got so many other routes. In Kenya, we call them panya routes. Yeah. We have got so many other routes that like these illegal drugs are finding their way into the country and finding their way like into the market. The government is trying so hard, to kind of regulate. For example, like the Central Equatoria government, where we are based, they have tried their best to kind of like, regulate the consumption of alcohol, like, in the market, including like the volume and the amount and percentage, by regulating the licenses, by making sure what time they open, by making sure what time they close, and all this kind of thing. It's actually like work in progress, because like all these policies that we have, and rules, it need proper implementation. And when we are looking at the implementation, it sort of take time. We get it correct today, we hit and miss, and then we improve on what we have not done, like yesterday.
Yeah.
So like from the perspective like a Minister of Health, we are doing a collaborative work, with the health ministries in the states, with the law enforcement, with the labor market, to make sure that like the goods that are being consumed in our countries are actually like sort of inspected and seen through. But still, the public has got a role, because like you and I know that we have got relatives who will bypass, all these things that we are trying to say. Yeah. By bringing goods and by saying no, this is my thing and it's very good, and bringing illegal things in the country. So the public has got a role. The government has got a role to play. But the government cannot play a role by itself when the public is not cooperating. So the public has to be vigilant, like what is in their neighborhood,
right,
and how are they going to get rid of that thing in the neighborhood? Because who is government? Government is a civilian. Government is you and I. It is not only like the people in the executive.
Yeah.
Yes.
All right, you've mentioned a couple of things, from what causes people to abuse the drugs that we are talking about right now in South Sudan. It's the war and everything that has detailed in it, and also talking about government regulating some drugs. And now coming back to the role of the government, you say the government is you and I, but there is a body that actually controls. You say that the borders, we have legal routes whereby we can have drugs coming into the country. But once they are into the country, we know the root causes why these people are taking the drugs, but now we should not let them take. So what does the government do once they are in the country to be able to not make people buy or sell those drugs within the country if they come through the illegal way?
As I mentioned earlier on, that we have got let's say the legislature, which is now like the parliament and the executive body, that mean like like the policy makers. But we have got those who are actually doing the implementation. The implementation now trickle down like to the grassroots, like to the market. Let's say the city councillors that you see going from shop to shop, they are actually trying to see which product are in there, and those products are in there, are they allowed in the country or not? And if they are not allowed in the country, they are taken off the market. And when they are taken off the market, you are given a warning or you are fined. So like this is the best way to make sure if these illegal things get into the country, you know, we have got people who are actually trying to implement this thing. And again, I'm going to stress, you know, we are now talking about it here, but the public has got an upper hand, because like I'm a minister of health. Like, you know, my role is actually like it is almost like very limited to overseeing. You know, I cannot go to each and single shop, you know, to see that like there's illegal drugs being sold there. But the public is already there. Yeah. So if the public are aware that like these ABCD drugs are actually harmful to your own health, you know, you should take part in making sure that like, you know, they like, you know, they are off. And you should making sure in taking part that, you know, such and such things are actually reported to the authorities.
Okay. Yeah. And talking about that, do you think it's lack of ignorance or people are not educated on substance abuse in the country?
I wouldn't say it is ignorant, because you will find that people who are actually addicted are very brilliant, intelligent people, very useful people to, you know, to our society. But sometimes when you are addicted, you actually need help. You know, like you need help to break like that circle. Okay. And like, and help, it is not a one-way street. It is a multiple phase, whereby you have got social support, you know, from the community. Yeah. You know, you have got support from the family, or let's say from your spouse or from your children. If you are a child, your parent need to accept you, who you are, and help to walk you through. You need to have a sense of hope. You know, when you have got a sense of hope and a sense of purpose, you'll find something to do. You know, it also goes back to economy. Yeah. You know, like if people are functioning well, like, you know, if you are like, let's say, providing for your family, you will be looking forward to development. It will actually take time away, you know, from you focusing like on things to make you feel better. You know, it is like what we say, let's say if you have got 2 children, one child is doing very good in the school, and one child is actually struggling because maybe you are forcing them to take sciences. And maybe they don't want sciences, they want arts. You know, so you also need to see, how am I going to support this particular individual to be the best version of themselves? You know?
Okay, and talking of addiction, is there a center set up by the ministry to actually help those people that are addicted to rehabilitation center where those addicted are taken to and taken through training so that they become sober and come back to their normal?
We have got structures, but now you cannot just have a building and a department without resources. Okay. You know, and we like it or not, mental health in this country has been put in the back pedal. Nobody wants to talk about it. Nobody wants to fund it, and people look at it as a joke. You know, but in some of us who have gone through the education, you go through the education for 8 to 10 years to be a specialist in mental health, you know, wellness. You know, but here it is the provision of it is actually very, very minimal. Here in Ministry of Health, we have got a directorate that is in charge of psychiatry unit and mental health. We have got Dr. Atong Longhara Ayuel. She's our psychiatrist, and she's the one in charge of this department. You know, like mental health and psychological wellness. And myself, I'm a psychologist, and we have got like, you know, some other individual, but it is not well funded. And when it is not well funded, you know, like you need a series of structures and series of treatment to give to people who are addicted. It is not like a one-day thing. It's not like taking malaria medication, then 1 week, you are okay. No, it is a process, you know, and it takes longer, you know, for you to have got a method to help one individual. You need somewhere between 3 months to 1 year or more. So all that is need funding. It goes in phases, like, you know, to do like the chemical balancing in the brain, which is done by psychiatrists, to psychotherapies and counseling, which is done by counselors, and again, like, you know, to facilities that they are provided for, you know. So all these things, it is need like what we call client-centered holistic treatment. And client-centered holistic treatment, right now in South Sudan, it does not exist because we don't have funding. We don't have resources. And I do appreciate that we have got some NGOs that come in and they do what we call short-term, you know, awareness. like that short-term awareness, it is good to actually like, bring things to light, but it is not enough. Enough need to be done in this area, because like psychological well-being of the country, as I mentioned, it is very poor, and that's why we are struggling. That's why we are struggling, like like in all arenas of South Sudan, because we have got traumas that we are supposed to be dealing with, and it is not brought to life. For example, a few weeks ago, the president of this country launched Truth and Reconciliation Healing, like commission.
Yeah.
That Truth and Reconciliation Healing Commission, the center of it should be mental health experts. But now, if it's not going to be funded, when victims come forward, or let's say survivors come forward, to kind of open up, we are opening up wounds. And when you open up a wound, you need to clean it out, dress it properly, and make it heal. All these things goes back to mental health. And as I mentioned, if the resources are limited, it's actually going to be very hard to get rid of all these substances. We will take them off the market. People will find other means to actually can bring them back to make themselves feel better.
All right. Let's talk about legal and illegal drugs in the country. What drugs are legal and what drugs are illegal, illicit drugs in the country?
The list is very long. And the best thing that we could do is actually provide like the list, because like the list of, for example, as I mentioned earlier on, weed, which is called banki, it is illegal.
Okay.
It is illegal in the country. Cigarettes, it is legal, but is cigarette good for your body?
No.
It is still like a substance, has got nicotine in it, but it is legal. But it also goes down to individual, consumption. If you consume too much of cigarettes, which is a very legal product in the market, is also a substance. It is going to be harmful to your health, and you also get addicted to it. Banki is very bad. We have got this thing called serotonin, the one that like you find, young boys, let me call them street children using. It is glue.
The glue.
The glue.
Yeah.
Like the glue is highly illegal.
Yeah.
But they just go into the shop. They buy the glue, the normal regular glue that you use for some other things. Yeah. They mix it up and they use it. It is illegal. So we have the list is very long.
What about shisha?
Shisha, it is exactly like a very blurry line, because shisha is pivoting between the cigarettes and some other substance like that are mixed in it. So shisha look like a softer version of cigarettes, whereby it is acceptable. It has got this fruity smell, nice smell, and it is, some people look at it as a social status sort of thing. And also we imported it from the neighboring countries. It was not, we never had it in South Sudan,
Talking about importing it from the neighboring country, Kenya actually banned shisha, I think, 2-3 years ago, because of the same way people were using it. And now coming to South Sudan, I've seen a lot of abuse. You go to tea places, people are taking shisha. Earlier on, you mentioned about breastfeeding mothers, pregnant women. You see somebody's breastfeeding their child, they're taking. And recently, a photo went viral on social media of girls who are sitting for their current exams taking shisha before they go for the exams. I mean, what would you say on that?
As I mentioned, a lot of things are work in progress. For example, as we say, no, Rome was not built in one day. So it begins with us, getting these policies made by our parliament, and these bills are actually in process as we speak. And also it is going to be part of the constitution making process. So when these bills are actually made and passed, and then from there now it is going to trickle down to the executive. And then it is going to trickle down to people who are going to implement it. So it's actually work in progress. And of course, we all agree, things like shisha, and things like, these other drugs that are very harmful to us. Like you and I actually know it very well. But we need to have got very strong laws that the country is already working on. And, to have them so that when we are banning this thing, we have got something to quote and we have got something, to back it up with. Okay. It is already in process.
All right. And is there a campaign by the ministry to fight against abuse of drugs? I understand, let me use Kenya because I grew up in Kenya. There's a body called NACADA. That is a body that fights against abuse of drugs in the country. And so is there a body in South Sudan where the drugs, by the ministry to fight against abuse of drugs?
The Ministry of Health work in collaboration with the implementing partners and developmental partners, and they are doing a lot of work, in having this awareness raising, in the communities. what we call through psychosocial support, whereby issues to do with trauma are actually, is number one, because like this is what we are trying to push for, to have got a healthy nation. And then like underneath it, we have got like how communities, you should actually try to look out for these things. So like there's so much work and awareness that has already been done, by developmental partners in conjunction with us. Like here in Ministry of Health, we have got a directorate, of mental health and wellness. So like that directorate is actually the body coordinating, with all the other NGOs in the country, and like, going all the way to Boma level. Because also like here in the city, we have got these very nice smelling drugs, but also, but in the Bomas, we have got what we call, aragi. In Kenya, we call it changa. Whereby it is locally brewed, Siko and all this kind of thing. And now they're adding into it some chemicals. Like, I had a baseline survey to one of the states, and my main areas told you is mental health and wellness. And I was focusing on why most young women who are way younger than me, I'm in my 30s, but women who are in their early 20s, late teenage, are actually in marketplaces, very drunk, and this is a business they are doing. So when we went there, we found that they're brewing this local brewery, that they do changa or argi or whatever, and also add into it hajar bataria, the battery, when you have got the battery that you put in your torches. There's that black part in it, the black substance, it is added into it, that is carbonate. And that carbonate make the thing very strong, and that is very harmful to your liver, and they did not understand that. So when I went with this particular NGO, we were trying, to actually educate them what we are consuming and putting in your body. It tastes very nice, but it will kill you quick. And trust my words, the people who consume that type of alcohol, for a month straight, they don't live in the second month, because all their organs in their bodies are destroyed. So there's a lot of work that is being done, but there's need for more work to be done, and there's need for funding, there's need for investment in this area. So the government is trying its best with the little resources that we have to push for it. And at the same time, as I mentioned, I call on the public, to also do their part. Because one hand cannot clap itself. Government cannot be clapping its own hand. It needs all of us to work together and actually make sure these issues are addressed properly.
Okay. In the long run, what are the impacts into the nation and generally to the well-being of this country?
I've said it before, I'm going to say it again. The long run of substance abuses, it is one piece of the whole issue we have about mental health and psychological well-being of our country. So if we address this small piece, of substance abuse, it is going to lead down to a healthy nation eventually.
Okay.
Yeah.
Aside from final remarks on this, we are done. Your final words.
No,
generally.
There's nothing much that I'm going to say. I want to say thank you for reaching out, and it is important for young people to actually seek information and give the proper information out to our public. Because the social media, or let's say the media in general, is the one that is going to help to inform the public on what we are doing and how we are doing it, because we are developing our nation. And the last one, peace implementation is very important. And it is important by unity, the proper information that is going to create development and sustain, our country.
All right.
Thank you.
Thank you so much for accepting my interview. We look forward to more interactions.
No worries. Thank you so much.
All right, thank you.
Appreciate it.